Postpartum mental health, identification, diagnosis, and treatment. Postpartum depression is the most common medical complication of childbearing, impacting 10 to 15% of new mothers. Some high risks for postpartum depression include inner-city women, mothers of preterm infants and adolescents, a woman with previous episodes of major depression, family history of depression, and depression during pregnancy. Depression after delivery typically persists for more than 7 months in 25 to 50% of women. Postpartum depression is typically associated with increased chronic medical disorders, risk-related behaviors such as smoking and alcohol abuse. Additionally, postpartum depression can impact temperament, self-regulation, and behavioral issues of infants of depressed mothers. It can also impact the relationship and bonding between the mother and the newborn. According to the DSM, an episode of major depression after delivery is defined as 2 weeks or more of persistent depressed mood, loss of interest in daily activities, plus 4 associated symptoms like appetite disturbance, sleep disturbance, psychomotor agitation, fatigue, feelings of worthlessness, inappropriate guilt, poor concentration, and suicidal ideation. These symptoms onset within 4 weeks of childbirth and are more persistent than symptoms of the baby blues, which include brief crying spells, irritability, nervousness, poor sleep, and emotional reactivity in the first 10 days post-delivery. Severe symptoms of postpartum depression include difficulty making simple decisions, anxiety, agitation, poor self-care, intense hopelessness, and suicidal ideation. An example of postpartum depression may look like a mother who has a terrible appetite, has lost 40 pounds since delivery, feels she is a bad mother, cannot fall asleep even when the baby is sleeping, and worries constantly about harm coming to her family. The most common measurement tool for postpartum depression is the Edinburgh Postnatal Depression Scale, the EPDS. The Patient Health Questionnaire, PHQ-9, is also commonly used. The most effective forms of treatment for postpartum depression include psychotherapy and/or antidepressant medications. Emphasis should be placed on early screening for postpartum depression to minimize severe effects and progression.